it's not just the lethal component, it's how many cases we'll ultimately have and how much damage is done to the population's organs and biological systems. So,
and I'll speak to that from personal experience. I've got a client right now that I've been working with and had massive clotting, and they couldn't explain the clotting. They treated it like other clotting. The clot is still there and runs from the entire length of the leg. In April, he was barely walking. Now we're up to walking and doing some other things, but I'm still seeing long-term effects that we're going to be dealing with his whole life. And I'm sure I'm not the only one seeing this. This is just...
Yeah, we're seeing even young patients with chronic fatigue who never had fatigue before, and just inability to exert themselves, which I have a patient who gets chest pain every time they exert. They do 20 minutes, 10 minutes on an elliptical, and they're exhausted with chest pain, and that's not who they were prior to having the infection. We're seeing, I know my cardiologist friends are seeing early heart attacks and strokes, and the neurologists. So, we don't know what we don't know. We didn't know this was the outcome.
It takes a lot of energy to be an ICU nurse. Well, for one thing, the PPE use, that was personal protective equipment. That was complicated because during Ebola, we basically had enough personal protective equipment because there weren't that many cases. It turned out in Ebola, there was a total of 28,652 worldwide cases. This is according to the World Health Organization, and 11,325 deaths. But so far, we've had, I think it was mentioned, 27 million diagnosed with COVID in the US, and we've had about 381,000 deaths. So the PPE was complicated because we found out we didn't have enough. And which I think we should have known ahead of time. But as an infection prevention nurse, we always taught people how to use PPE, how to don it, doff it. You should only use a mask in one patient room, take it off. It got very complicated because they had to change the rules on PPE, telling people to do things that they really shouldn't be, like wearing a mask in multiple patient rooms, saving it, keeping it in a bag, all of those things. That complicates the care. As a nurse, you're being very careful. You're putting on the PPE. Then when you take it off, you have a lot on your mind. You might be having people talk to you, thinking about what do I do next for the patient, monitoring the patient. And I have to make sure I take this off without touching the front of the mask, and then touching myself and washing my hands enough and all of that. It sounds kind of minor, but when you're very busy and taking care of such sick people, it can get complicated.
I've never seen anything like this. And so the entire, I remember rounding on TB patients back in, my residency in med school, and we were very careful, but we had one TB patient on the ward, and you were actively generally just trying to rule them out. They were not, you were suspicious of TB, and you put them in a negative pressure air room, and, one or two at a time. Like, we're talking hallways from my colleagues full of COVID positive patients who are actively sick and can spread the illness. And, I have a friend who's 50 years old, not even, and he's a physician who ended up on 40 liters of oxygen, which I had never heard of, high flow, in the ICU for 2 weeks. A really active guy, he's a healthy guy. So people they're not getting it. Like, this is serious. The load on the nurses and the staff and the doctors, everyone is completely overwhelmed. The fact that we didn't have PPE for them for the first 3 months of it's mind-boggling